So my name is David O'Toole, and I'm the former CEO of the Canadian Institute for Health Information, which is a big supporter and implementing partner of the interRAI suite in Canada. I was there for about 10 years, and during the course of that time, got to know John Hurdy's quite well. We get along, but I also believe in the value of the interRAI tool set in the community, in the international community that we've ever tried to persuade people to adopt. Yeah.
What was the most outstanding experience that you have in terms of the application of interRAI that you think really was an aha moment for you? Like, this is really powerful.
It'll be different than it might be for a person who's imbued in the environment.
Sure.
I'm not a clinician, as I've said earlier. And it was our ability to, post-pandemic, there was a number of commissions of inquiry struck in different provinces in Canada, and the federal government had an active interest in finding out why information about the aged care experience was so difficult to find in an integrated and systematic fashion across the country. And there was a lot of apportioning of blame, and it went through the usual questions that, the mortality rates were due to the private sector being involved in the delivery of long-term care in Canada, attribution to various other characteristics. It was very, very powerful for me to be able to work with the interRAI folks, because we worked in support of these different commissions to provide information as part of their deliberations. And on a number of occasions, the interRAI work was able to redirect the conversation to what the evidence and data actually supported, as opposed to the foregone conclusions of either the media or the people who were involved in the investigation. And to me, that was tremendously meaningful in terms of establishing some insights that have long-term impact on the discussion about how to deliver aged care or long-term care in Canada.
That's a game changer for government.
I think in doing that, the value of the interRAI data set and collected and aggregated information to the policymaking and political decision makers was really important. Yeah. The other thing, it's going to sound silly, or at least mundane and banal. A conversation about data standards does not get everybody's mojo going in the policy and political circles. It's actually mind-numbingly boring for most of them, and I don't understand why it's so. Post-pandemic, we were able to say, here's why standards matter, using the interRAI discussion and making a direct connection to effective policy based on outcomes. And why, if, for example, if we need to prepare as a jurisdiction for an H5N1 outbreak in the near future, the lessons learned from the past one, I hope, will not be forgotten. And the ability to say, we need data standards in place across the country that allow us to collect comparable information from across the country to be able to formulate policies that have to be enacted very quickly as part of a pandemic management effort. And the interRAI group was part of that discussion too. And the ability to demonstrate the value there was very important.
Do you have a message for the Australian healthcare and aged care agencies? What would you see would be the benefit of implementing interRAI in Australia?
Australia has this unusual opportunity to implement at scale some really ambitious aged care initiatives that will address the recommendations from the Commission report, but also allow them to leapfrog the obstacles or mistakes that other jurisdictions have made in the last decade, and to learn from those. And again, I'm not here as a salesman for interRAI, but in terms of the ability to collect data in an efficient fashion and have a high repository of high quality data immediately available for care planning, administrative and management purposes, and policy making, I haven't seen anything else that meets that criteria yet. And Australia has the opportunity to actually implement something like that in a consistent fashion, according to standards and principles that are common across the country. And I would say, given the stake the Commonwealth has in investing in that, and the agenda and timeline it has an ability to do that and see some early results in a meaningful period of time.
Yep.
I think it would also provide insights into the disability challenge that exists in this country as well, where they intersect with aged care.
Very topical.
And allow to develop a roadmap for the disentangling of those areas as well.
That's very valid. Thank you.
My
Thank
pleasure.
you, and thank you very much for your time.
That was useful.
Yes.